Hello, I'm Dr. Angela Dearinger, Commissioner of Kentucky's Department for Public Health. I'm also a Med-Peds physician and a strong advocate for the health of all Kentuckians. As Commissioner, I'm privileged to have the unique opportunity to lead policy initiatives and programs to promote the health and well-being of all Kentuckians. It is an honor to serve those of you, my colleagues, on the front lines of care. We all know that in public health and healthcare in general, prevention is of the utmost importance. When we can prevent an illness rather than treat the resulting disease, everyone benefits. When it comes to influenza, vaccine is the best tool we have for prevention. That is why having the support of the physician community is so important in our efforts to promote flu vaccine and prevent flu. As doctors, we are who Kentuckians trust most when it comes to making important healthcare decisions. As you know, flu season is well underway, and at the Department for Public Health, we are busy promoting vaccination. You may have heard discouraging information regarding the effectiveness of the flu vaccine. And we know it's not unusual for myths about the flu vaccine to continue to spread. Last year's flu season was the longest on record. Actually, we had 2 seasons in one. The first wave, influenza A H1N1, peaked in mid-February. At that time, the overall vaccine effectiveness was 47%. The second wave, influenza H3N2, hit in mid-February and didn't peak until mid-April. The vaccine was only 9% effective against H3N2. Due to that second wave of flu, the overall effectiveness of the 2018-2019 vaccine was 29%. Last year in Kentucky, there were over 17,000 cases of the flu, 193 deaths, including 2 pediatric deaths. Nationwide, the CDC reported more than 647,000 flu-related hospitalizations and 61,000 deaths as a result of the flu. Children ages 1 through 10 were hit particularly hard during the 2018-2019 season in Kentucky, with 34% of the state's total affecting this age group. Vaccine effectiveness, though, is highest in this age group every year. Unfortunately, 80% of pediatric flu deaths in the U.S. were unvaccinated. This is heartbreaking, considering the ready availability of flu vaccine and what we know about the seasonal prevalence of influenza. Flu is extremely common, very serious, and sometimes deadly. We should be doing everything we can to prevent it. This year, the influenza A H1N1 strain and the H3N2 strain were changed for the 2019-2020 flu vaccine. In fact, the World Health Organization waited an extra month to precisely determine the H3N2 strain to include in this year's vaccine, to try to get the best match possible. As you know, people with chronic conditions are at greatest risk for adverse flu events and death. Research shows greatly improved outcomes for people with heart disease, asthma, and disabilities just by getting the flu vaccine. As providers, we need to join together, educate our patients about the flu vaccine, and focus on groups that need special attention: pregnant women, children, elderly, those with chronic conditions, and individuals living in or working in long-term care facilities who are most at risk for complications from the flu. I want to specifically mention that Kentucky's flu vaccination rate in pregnant women is unacceptably low. The flu vaccine is safe for pregnant women. After being vaccinated, pregnant women transfer antibodies to their babies, protecting them until they are old enough to get the flu shot themselves. Last season, infants as young as 2 weeks old contracted the flu. Pregnant women need to be vaccinated against influenza. As of October 22nd, we have 252 total confirmed cases of the flu in Kentucky, with no deaths. The Department for Public Health Flu Activity Report is posted on the department's influenza website and the Kentucky Health Alert website every Friday. It's time to focus on the flu. Not just as individuals, but we as the healthcare community must do more to ensure Kentuckians are taking the necessary steps to protect themselves, their loved ones, and our society as a whole. Thank you for your time. I look forward to working with each one of you to promote the health and well-being of the Commonwealth.